Hello again, and welcome to Health Matters on Channels Television. We are glad to have you with us. I am Mary Alala Yusuf. Nowadays, antenatal care and the use of vaccines has reduced the adverse conditions of children during pregnancy, at and after birth. But there are still some conditions humanity is contending with. Some of these challenges could be very daunting when performing the simplest of day-to-day tasks and moving from one place to another. Conditions like cerebral palsy and clubfoot may have grave implications for social associations if not properly addressed. Today we look at some of the special challenges of children who have to live with these conditions and how modern medical interventions can help them have better associations and less pain. On the show with me today is a consultant plastic and reconstructive surgeon from the National Orthopedic Hospital, Igbobi, Dr. Muna Chira. Dr. Chira is also the head of Training Schools Education Research and Statistics at the same institution. You're welcome to the program, Doctor.
Thank you very much.
Let's begin by talking about some of these special needs. I've already mentioned cerebral palsy.
Yes.
What are the special needs of someone with cerebral palsy?
Thank you very much for the question. The patient with cerebral palsy has issues with movement. Because of the condition that affects the brain, the developing brain, these children have problem with their muscles, with their tendons, and with coordination of activities. So these children have, because of it ends with stiffness of the extremities. So they're unable to move by themselves. They are also unable to coordinate activities by themselves. So they will need physiotherapy, they will need interventions to be able to stretch those muscles and allow them to be able to ambulate.
Okay, you spoke about physiotherapy.
Yes.
But you are a plastic surgeon.
Yes.
So how many people come into play, for example, to help this little girl that is on the screen? What different specialties come into play?
Well, the children with special needs, their problems are multifaceted. So also the management of their problems is multidisciplinary. So it depends on the condition we're talking about. And we have a variety of experts that can come in to help.
So let's take cerebral palsy.
For a child with cerebral palsy, for instance, they will need, I mentioned a physiotherapist, they will need an occupational therapist, they may need a surgeon, plastic surgeon or an orthopedic surgeon when they have tendon stiffness. So they may need surgeons to release those tendons and free up the joints. Okay? And then they may also have special educational needs too. So they would need assistance in that direction. They may also need orthotic experts to provide some devices to assist them. Splints.
Okay, the orthotic devices. Specialists give devices.
Yes.
The orthopedic surgeons do surgeries.
Do surgeries, are correct. Okay. Yes. So orthotic experts, they provide some kind of devices to stretch the muscles, stretch the tendons, and allow the joints to free up.
In patients with cerebral palsy, do they also get like special shoes to wear?
Yes, sometimes they may need to get special shoes, yes, depending on where the contractures are. So if they're around the ankle area, for instance, they may need to stretch the ankles into specially made shoes to help by way of stretching them and lengthening them also and providing the right position. Okay,
now I know that for someone who has cerebral palsy, there may be some laxity in the face because of muscle weakness or something like that. Does a plastic surgeon come into play in the management of such a person?
Not from the surgical point of view, because generally what they have is they have stiffness of muscles. Okay, they have contractures and they have hypertonicity. The muscles are the tones, or the muscles and tendons are high. So that can happen in muscles in any part of the body anyway. But when they happen on the face, the correction is not surgery. Rather, it's through drug therapy. There's some drugs that we give to relax the muscles and allow the patient to be able to talk or eat or act, use the muscles.
But they would need a speech therapist.
Yes, sometimes they need speech therapists, sure. Sometimes. Depends on which area. One thing is that the patients, they present, they have customized presentation. So you look at them, you evaluate the child, and then the care is customized.
Okay,
that's what I mean.
That's where I wanted to come to, because it's like a different patient, a different
correct,
a
yes.
different plan,
yes, different
and a
plan.
different plan of treatment.
Yes, because sorry,
go on.
cerebral palsy is a range of conditions, you know, and some of them are very severe, some are not so severe, and also even the mode of presentation. Some are spastic, that in terms of, like I've been mentioning all along, spastic
stiffness of muscles.
Some their own is coordination, some their own is tremors. They have tremors. So it depends on what part of the brain is assaulted. That will determine the presentation. But all those group of conditions are regarded as cerebral palsy.
Okay,
so,
but with interventions, you know,
yes.
maybe therapy and a few of these surgeries that they do,
yes.
can somebody like that live a better life?
Oh,
like maybe less tremors,
definitely,
less spasticity,
definitely,
and maybe school.
Sure.
Normal school.
That is the essence of the intervention. When the children are brought early enough, and intervention starts pretty early, certainly the whole essence is to make them independent in the activities of daily living, and also to help them to assist themselves in school. So if the intervention is early enough, before the muscles get too strong and too stiff for anything good to be done, then yes, the outcome is a lot better.
How